Hello, I'm Nancy. I'm one of the owners here at SpaRenity, a day spa and wellness center. I've been here for 12.5 years, and my primary focus on a daily basis is taking care of your skin. We also have body treatments, but today I want to talk for just a few minutes about problem skin, specific problem skin concerns. I chose to use a company called PCA Skin. It stands for Physician's Choice of Arizona. There are two dermatologists who started the company many years ago, and I already had a primary line that I was using on the back bar and for retail to clients, but something in some of the people that I was experiencing, they needed just a little bit of extra peeling effort. And let's face it, modern society, we like instant results and we like things now. So, and the other part of that is that people have gotten accustomed through the grapevine or what have you, hearing about chemical peels, chemical peels, chemical peels. Well, what I know about chemical peels is everything Physician's Choice of Arizona has taught me. And basically it's not really a chemical, but it's lactic acid, salicylic acid, malic acid, tartaric acid, and each one of those acids come from natural botanicals. One particular malic comes from apples, sour apples. Tartaric, I believe, comes from grapes. And when combined together in the right potency and the right strength, we can address concerns in people's skincare, daily skincare, and in the spa environment. We can address specifically what you come in with a concern about. For instance, one of the routine things that we see, especially in the Florida area, and it probably happens elsewhere in the United States too, is a condition called hyperpigmentation. Now that can be caused for many different reasons. It has another name, sometimes melasma. A lot of times that is specifically related to hormones and being out in the sun, or medications and being out in the sun. So Physician's Choice is very particular about how we understand how the skin works, how the melanocytes work, how to interrupt their activity, and how to help lift some of the blotchiness and discolorations off the skin. Depending on the person's assessment, if they are oily or if they are dry, and depending on what type of hyperpigmentation they have, we make a choice on the specific product that we'll use. Physician's Choice has about 6 different peel products, and not all of them will cause your skin to shed, but for the most part, some people think if they don't peel, then nothing good is happening. One of the things, once again, about this company I like is that they are full of antioxidants in addition to helping the skin loosen up, break the glues that bind it together so it will shed, and putting multivitamins and healthy ingredients back to the cellular level. You can effectively change the color of your skin in the hyperpigmented areas, but it does take a commitment on a person's part in knowing how to avoid the sun, wearing sunscreen, and applying a home care regimen and staying committed to it. The other piece of the puzzle that they treat a little more aggressively is acne skin. Acne skin is on a grade of scale of 1 to 4. Grade 1 acne skin, for instance, has open and closed comedones. The comedones are what we know as blackheads, and it may require just a couple of treatments to help shed that top layer of skin, help the oils surface and make for a better cleansing. And then we address the skin's underlying problem of overproduction of oil, or is it because it's not shedding often enough? When you get to grade 3, grade 4, the higher levels of acne, it's very, very important to know the anatomy and physiology of the person's skin and what medications they're on, what they've tried in the past, but the same principles apply. We try to undo the clogging, unstructure that top layer of skin that has gotten so tight and so bogged down that it holds oil down in the follicle and down in the pore. And when a chemical such as the lactic acid, salicylic acid, malic, etc. is applied in certain percentages, it will help the skin shed. And once again, we're back at that place where we're helping to calm the skin, especially in level 3 and 4, and address the underlying issue of overproduction of the oil. The other important thing is that not everybody is socially ready to go out into public with their skin peeling, because you literally do on about the 3rd day start to see cracking right around the perioral area here, and then after that a few more days you'll see around the eyes and cheeks. And so if someone's not wanting people to know that they've had a chemical peel but are still wanting improved skin condition, there are products that PCA makes that can help tighten and firm and microscopically help the skin shed without everybody having to know that you've gone for a peel. One such peel is the pumpkin peel. We like to do that one during the fall time because it smells so much like pumpkin, just like the pie, and it's really fun. It has antioxidants in it, in the pumpkin itself. There are about 27 different vitamins and antioxidants there, and we know those as vitamin A, vitamin C, vitamin D, there's even vitamin P and F, which, you know, until I got into this world of business, I never knew there were such vitamins, but they go into the cellular side and the nucleus of the skin cell and help it repair itself. So not only are you helping resurface that top layer, but you're putting healthy ingredients back in so the skin can do its natural, God-given purpose and perform its functions properly. The pumpkin peel is very easily done. You cleanse the skin, apply a toner. We assess a level of 1 to 10 with all of the peels that we do on a pain scale, 10 being the highest, 1 being the lowest. And then we also have a trained eye as estheticians to focus on the skin, see if we're looking for any frosting. It looks like the white stuff inside the freezer of your refrigerator, or blanching, which just really looks white and blanched. The skin is changing color. So we need to be alert for those things, because that's probably just enough of that product in that area. Some of the peel products can be removed using water, but with the pumpkin peel that's the case. Some of the other peels, the Ultra Peel 1 and the Ultra Peel Forte, no water is involved. It's just a layering of products. But after the mask is set on, the pumpkin aroma mask is set there for about 10 minutes is the maximum. You remove it with water, and then there's an application of the gel as well as a balm to calm the skin down, and again deliver the appropriate ingredients as antioxidants. Visible is another ingredient that's very good at giving hydration back to the skin, but it helps in all skin types, and it's really a nice peel for people who have oily skin. The last main condition that PCA likes to treat is called the anti-aging, and we all have heard about that over the last 20 years or so. It's like we're all thinking about it. So one of the ways that the anti-aging products can help is by, once again, removing the dead layers, sending that message to the brain that it needs to reproduce itself. And in the meantime, you're putting on topical vitamin A, topical vitamin C, regenerating serum, any of the aftercare products that are very targeted to what your concerns are. And probably after the second to third visit, most people already feel like they look 5 to 7 years younger. We do recommend that you get the peels in a series of 6, and then you can repeat that once or twice a year if you prefer. Just be prepared. Sometimes you will have a little bit of downtime, as we call it. But for the most part, I think that this is a gentle way to go for a restructuring and healing of your skin. It's non-surgical intervention, and easily I have seen people who have come in with very dark, hyperpigmented skin and leave with flawless, same tone, same pigmentation throughout their skin and chest area. Removing hyperpigmentation is one of the biggest challenges. Acneic skin can clear up in 1 to 2 treatments. Again, a series is recommended. And then in the anti-aging products, we do what we can within the confines of the social setting, and making sure that we target the areas that the individual is most concerned about. You will always need aftercare, meaning I'm not going to follow you home, so there are products that we have here that Physician Choice uses to specifically help you in your home care regimen, and I will prescribe those for you as your needs require. So if you're interested in a Physician's Choice of Arizona chemical peel, remember, it's not that bad, terrible word, chemical, that should scare you. They're naturally produced in the earth, and we use them to help our skin get healthy. And I hope to see you soon so I can help you on your path to wellness.